Our viewer question today comes from a registered nurse, and she has asked, how can registered nurses best get involved with the plant-based movement?
Talk about professions that are undervalued and underpaid, along with teachers and law enforcement officers, registered nurses, everyone in the nursing profession. They are angels for what they do. I know in the hospital, when I would admit patients, I would see them making rounds in the morning. I'd check the patient, they'd write my orders, and I'd leave to go to the office. It's the nurses who actually give the care, and they're the ones who are there. And when I had my back surgery a few years ago, I was in such pain. Thank heavens for those wonderful nurses who checked in on me and really cared how I was doing. I have such respect for the nursing profession and such affection, because how many times they saved my backside with a phone call. Doctor, there's a patient you ought to come in and see. And because they know what they're looking at. They're there with the patient, and they're fine clinicians. So I'm a big fan of nurses, absolutely. So with that said, here we are in 2020, and we've seen this tsunami of change go through all the healing professions, and one of the most promising waves of that change is the whole concept of disease reversal through lifestyle medicine. Most people are making themselves sick with what they're eating and how they're living their lives, and if you can get them on a whole food plant-based diet and start reducing the stress in their life and increasing their sleep quality, they get healthier. And so many physicians are focusing on lifestyle medicine, and it's remarkable to see physicians either incorporate the practice of lifestyle medicine into their existing practice. The pediatricians, the internists, the family doctors, they're taking the best of lifestyle medicine and turning it into a uniquely potent tool in their healing practices. And I've seen doctors leave their profession. I've had anesthesiologists and pathologists say, I really want to be dealing with patients and helping them on plant-based food tracks there. And they do what they can do. They give courses at night. They attend the meetings. They talk with their colleagues. They do the best that they can do where they're at. So that brings us around to the nurses. The same process surely is affecting the nursing profession. And as this writer is asking, what can a registered nurse do to start getting on the plant-based healing train to bring this message to her patients? Well, first of all, know that you are not alone. There are so many nurses waking up to this. I get so many letters from nurses and comments at meetings. So I urge you to find kindred spirits, and the place to look for that, without question, go to the website of the American College of Lifestyle Medicine, ACLM.org. And you will see practice groups and discussion groups. If you type in registered nurse, you will be taken to the discussion room where lots of registered nurses are talking to each other about how they can use lifestyle medicine in their own practice. So that's definitely a place to start. And the American Academy of Lifestyle Medicine, of which I'm a member, has an annual meeting every year. The last one was in Florida just before COVID hit. And this, and the next one, this last one was virtual. That's correct. So go to those meetings. You'll see people, you'll hear lecturers, you'll see comments go by, connect with those people. So ACLM.org is a good place to start. There's another wonderful organization called the Plantrician Project. And plantricians are healers who use plant-based medicine as the basis of their healing. And this is Dr. Scott Stoll's organization, and they too have a wonderful conference every year. The last in-person Plantrician conference brought over 1,000 physicians and nurses together from around the world. They were there from Egypt and Israel and the UK and Thailand and Australia, New Zealand, Canada. They came from everywhere, South America. Well, there's nurses mixed in with that group as well. So go to the Plantrician Project and type in registered nurses, and you'll see a tier of activity there involving registered nurses. Then you've got to look at where you're at, what your interests are, what your passions are, and what your current situation is. You know, the old saying, do the best with what you have where you are, you know, and that certainly applies to nurse. Nursing is so ubiquitous and so universal. You'll find nurses everywhere in public health and hospital nursing and in childcare, in geriatric settings, wherever you are. Look around, and if you're happy in that setting, if you know you're a pediatric nurse in your being, if you know you're a surgical nurse, if you know you're an outreach community nurse, well, that's the context you're looking at. So what can you do? First of all, get educated about the subject. There are courses to take in plant-based nutrition. Go to do a search on to the University of Winchester. This is in the UK, in Wales, I believe, or in Western England. Anyway, it's in the UK. Go to the University of Winchester and take their 6-week course in plant-based nutrition. And they go through so much of the clinical material that will give you a firm foundation. You should take Dr. Furman's course. You should take Dr. McDougall's, go to his website and read his newsletters and take their online course. Dr. Colin Campbell's eCornell course. Take these courses. Know wherewith you speak. Educate yourself on the subject. And the more you learn, the more you'll see, and the more you'll know what to do. Along with educating yourself, set a good example. Adopt a healthy, whole food, plant-based diet. You don't want to walk in overweight with signs of disease. So we'll say a pocket full of pills. You want to set a good example just by your being. And so get those salads going in those whole food, plant-based meals. Absolutely. And then look around and see what's the need. Who needs what here? Everyone needs education. There's so many ways to do that. Anything from dropping off a one-page handout, just an index card to your patients with websites for them to see and videos to see. You can just start with that. If you're in a group setting, show a video, show forks over knives, show what the health, show one of these videos and start a conversation about it. Do a food demonstration. People don't know what plant-based foods is, so bring in a blender, bring in a hot plate, show them how to make a smoothie and a salad dressing and how to cook rice. There's so much that a simple demonstration, it could not only show them, but a taste is worth 1,000 words. When you put that tofu lasagna in their mouth and they say, ooh, if that's plant-based food, I could eat that. You've changed their lives. So all of these are avenues. And I was working for a while in a lifestyle medicine practice, and in our office in the evening, the office was empty, and we had a big waiting room. So our patients who would be interested, we would send out notices. In the evening, we'd set up a table, we'd set up a video monitor, we'd show a brief video, we'd do a food demonstration, and people would, all the attendees would stand up for a minute, and they would talk and introduce themselves and the relationship with plant-based meals and what's working for them, what's not working for them, what problems they've run into. And they realize there's a community of people with the same issues, but maybe some good solutions. And for the 90 minutes that we spent in the quiet waiting, the empty waiting room of our medical office, a lot of good education happened. And for basically no cost at all, just the time and the energy of the people who put on that little class. And so all of this is low cost, but it's just educating by our example and by our knowledge that you acquire by making a serious study of it. So there's lots to do. And as you go advance down this road, you're going to meet other people, including other RNs and LPNs and nursing assistants. And everyone needs to see this. And it always would break my heart in the hospital, in that, it started out being funny, but after a while, and this is in classic hospital work, make rounds when I was an anesthesia resident, there's always, so often, not always, but so often at the nurse, there's a box full of donuts and baked goods there, and it's given by grateful patients and appreciative nurses, and it's with all the love in the world. But meanwhile, the people at the nursing station eat the donuts, etc. And obesity is just rampant among the nursing profession. And it breaks my heart for so many reasons. And these lovely people run into heart disease and diabetes, etc., as well as not being able to do their job well and not setting a good example for health. So I'm really rooting for the nurses. Educate yourself, adopt the whole food plant-based diet, and start letting your light shine forth in whatever form that takes in the classes and the examples you set. And the more you reach out, the more you'll find that your sisters and brothers are out there with you, and a wonderful awakening is happening that you get to be part of, because you have those wonderful magical initials after your name, RN. Thank you for earning those and for using them to make this a better and more loving world. I also left out the Physicians Committee for Responsible Medicine, PCRM.org. Go to that website and you'll see opportunities for nurses as well. So thank you for that question. So important. And thank you for everyone who follows up on those observations. All the best.
All right, perfect. Thanks, everyone. We'll see you guys next time.
Bye-bye. Thank you. Hi, everyone. Dr. Michael Klaper here, announcing our new format for our Q&A with Dr. K. Each day, Annie Hagen will be asking me one question that's been sent in by our viewers. So if you want to see if your question is getting answered, do join us for our daily Q&A with Dr. K right here. Hope to see you then.